anti-inflammatory drugs. So the anti-inflammatory drugs, they can be divided into two, like non-steroidal anti-inflammatory drugs and steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs are very commonly known as NSAID, non-steroidal anti-inflammatory drugs. And the steroidal anti-inflammatory drugs, they are known as corticosteroids. I hope you know corticosteroid physiology you are learning from where it is secreted. So, from where it's secreted, usually the doubt comes from adrenal medulla or cortex. So, always remember cortico, it is secreted from the adrenal cortex. And the secretion found to be the maximum during the early morning hours. It is known as a stress relieving or a stress hormone. It relieves the stress, it prepares the human being to overcome the stress during the morning hours after waking up. Like it improves the blood glucose level, giving more energy. It stimulates the body functions so that the individual or human being will be more able to be more active during the early morning hours. So this is important. Kindly note down the corticosteroid secretion is maximum during the early morning hours, though in the figure it is from starting from the midnight, but usually from 8 a.m. to 10 a.m. the corticosteroid secretion will be maximum, and it comes down by the noon time, and a slight increase is seen during the evening time. That's why again we feel more energetic during the evening time. So corticosteroids classification. So there are different way of classifying corticosteroids based upon their mineralocorticoid activity or duration of action, but I am giving a simple classification based upon the administration. So systemically administered, that is either orally or intravenously given corticosteroids: prednisone, deflazacort, methylprednisolone, cortisone, hydrocortisone, and dexamethasone. That you can easily remember. Hydrocortisone, it is given by IV route. Deflazacort or prednisolone or methylprednisolone, they are mainly given by oral route. In second classification, inhaled corticosteroid, which are used for inhalation, especially useful in asthmatic patients. You can pick out the easy names like beclomethasone dipropionate, fluticasone propionate, budesonide, triamcinolone acetonide. It's a bit difficult, but remember the easy names. Topically used like clobetasol propionate, betamethasone propionate. This is a drug confusing. Beclomethasone for inhalation, betamethasone dipropionate for topical purpose, mometasone fumarate. You might have come across mometasone. It reduces hypermelanin pigmentation. So this is a classical example about the mechanism of action, only for your reference purpose. Don't try to draw this figure for exam. It is only for the reference purpose. All steroids, they are having their receptors within the cell, because they are lipid soluble, they can cross the cell membrane, and the receptors are located either in the cytosol or in the nucleus. I hope you remember type 4 receptor. So once they bind to the receptors, they will alter the transcription process. So how that happens, just see that binding to glucocorticoid or corticosteroid receptor, you can change glucocorticoids as corticosteroid in the cytoplasm, and binding to once bound to the receptors, the hormone receptor complex will bind to a specific nucleotide sequences in the DNA, and they alter the transcription. Either they decrease or increase in the transcription process, resulting in increase or decrease in accumulation of mRNA in the target cell. As a result, there will be change in the rate of synthesis of specific proteins. So increase in certain protein synthesis, the proteins, they act as enzymes or maybe as transport proteins. Accordingly, their increase or decrease in the protein synthesis will bring about the biological actions of the hormone and also of the corticosteroids. Pharmacological actions of corticosteroids. The main is metabolic effect. First one is carbohydrate metabolism. They always causes hyperglycemia. I already mentioned in the initial slide. Early morning there will be increase in the blood glucose level because of increased corticosteroid secretion. They increases gluconeogenesis from the liver and kidney, increasing the blood glucose level. Decreases glucose uptake and utilization by the adipose tissues and skeletal muscles, because the aim is to supply more glucose to the brain so that the brain will function more efficiently. And finally, it will result in hyperglycemia, which will in turn lead to increase in insulin secretion. So the increase in insulin secretion again will lead to increase in glycogen synthesis and storage of glucose in the liver. Coming to lipid metabolism, it increases lipolysis. Already you've seen insulin, it is lipogenic, but corticosteroid, it is lipolytic. It increases lipolysis, increases plasma free fatty acid level. So increase in plasma free fatty acid level will again promote gluconeogenesis and increases blood glucose level. It increases the fat absorption from the intestine, again improve the fat level, or increasing the lipid level in the blood. It further stimulates, that is the increased level of lipolysis, increased level of blood glucose level will stimulate insulin secretion, which further stimulate lipogenesis. So that will lead to redistribution of body fat, resulting in buffalo hump, moon face and fish mouth, what we commonly call as Cushing's habitus. So this is one reason why the long time use of corticosteroid will lead to Cushing's habitus, that is buffalo hump, moon face, fish mouth. Moon face because more of fat deposition in the mouth will lead to pretty round face, and more fat deposition in the face will lead to a decrease in the size of the mouth, and more deposition of fat in the back on the shoulders, leading to buffalo hump. That is due to the insulin action, lipogenesis. Coming to protein metabolism, again the corticosteroid, they increases blood glucose level by improving gluconeogenesis. So definitely in protein metabolism, they increases protein breakdown and decreases the protein synthesis. So the main deposition of protein is usually in the muscles as well as in the skin. So it increases the breakdown of the protein from the muscles and skin, and it decreases the protein synthesis. And all these amino acids will be used for gluconeogenesis, and that will lead to muscle wasting and also growth retardation in children when it is given for long time. You can see the muscle wasting in the figure. Skin atrophies like thinning of the skin leading to bruising and striae. You can see that what we call usually stretch marks, and they delay wound healing. So what we see here altogether, the corticosteroid tries to increase the blood glucose level by increasing the gluconeogenesis. So to increase gluconeogenesis, they increases the breakdown of the fat to fatty acids, so that gluconeogenesis can occur. They break down the protein so that the more amino acids are available for gluconeogenesis, and decreases glucose utilization by the peripheral tissues. So overall, what the drug do, the corticosteroid do, it increases the supply of glucose to the brain. That is the main function what it do. Even if you starve for more days, your brain is not affected because corticosteroid will supply glucose continuously to the brain.